Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Interfaith group in Yobe State educates religious leaders about COVID-19 vaccinations for awareness creation among members of their congregations. Nigeria maintains lead in Africa with more second dose vaccinations across states. And WHO puts blame of recent 10% increase in new COVID-19 cases in the European region on increased mingling of crowds at football stadiums, bars and pubs. The world needs a global vaccination effort that will protect workers, mitigate adverse social effects and make strategic decisions regarding tourism. And this is taking potential structural changes into account. Well, this is according to Isabella Durant, the UN Conference on Trade and Development Acting Secretary General. She said that tourism is a lifeline for millions and advancing vaccination to protect communities and support tourism's safe restart is critical to the recovery of jobs and generation of much-needed resources. According to the reports, international tourist arrivals declined by about 1 billion or 73% in 2020, while in the first quarter of 2021, the drop hovered around 88%. Meanwhile, only 5 states recorded new cases of COVID-19 in Nigeria. Let's take a look at the report from last night.
24 hours, the Nigeria Center for Disease Control announced 75 new cases reported from 5 states and the FCT, the highest figure so far since the beginning of the week. Lagos, the epicenter of the disease, recorded 47 new cases. Gombe recorded 15 cases. 4 cases were reported from the FCT and River State. And Kaduna recorded 3 cases, while 2 cases were reported from Ekiti State. The latest report includes data from 29th and 30th of June from Lagos State, while 0 cases were reported from Imo, Kano, Oyo, Ogun, Plateau, and Sokoto states. And this brings the total number of confirmed cases to 167,618. 259 persons have been discharged in the last 24 hours, raising the total number of recoveries to 164,244. According to the NCDC, there are no cases on admission in Edo, Enugu, Nasarawa, Imo, Bauchi, Taraba, Sokoto, Yobe, Cross River, and Kogi states. There were no casualties from COVID-19 complications in the last 24 hours, leaving the fatality toll at 2,120. Presently, there are 1,254 active cases in the country, while over 2 million samples have been tested so far. The latest updates by the National Primary Healthcare Development Agency shows that more than 2.2 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while over 1.2 million of those vaccinated with the first dose have now received their second dose. Lagos State has taken the lead as it has now vaccinated more than half of its eligible population, followed by the FCT, Kaduna, Kano, and Oyo states. In Africa, there are over 5.3 million confirmed cases of COVID-19 and more than 140,000 deaths on the continent. Across the world, there are now more than 182 million confirmed cases, while deaths have surpassed over 3.9 million.
Religious leaders in Yobe State are being called to sensitize their congregation by taking the COVID-19 vaccine to limit the risks associated with the virus. Mr. Joseph Ahuche, Chairman COVID-19 Vaccine Campaign of Interfaith Dialogue Forum for Peace, made this plea at a one-day high-level sensitization meeting on COVID-19 vaccination for religious leaders in Damaturu, the state capital.
Ever since the outbreak of the coronavirus pandemic, there are those who don't believe the disease exists, while others doubt the efficacy of vaccines provided to combat the virus. This is in spite of sensitization exercises carried out by government and relevant organizations. This worrisome situation has prompted the Interfaith Dialogue Forum for Peace to undertake a sensitization program for both Christian and Muslim clerics in Yobe State on the need to get their members to embrace the vaccine.
We're targeting the religious leaders because we find that the religious leaders have a very big role to play. I know it's only a very few religious leaders that are saying no to the vaccine. They were also able to go through the scriptures of both the Christians and the Muslims to find out what exactly is said about it. And we're able to liaise with the health agents to find out the facts about the vaccine.
The religious leaders believe the sensitization exercise is a welcome development that has equipped them to better appreciate the significance of the vaccine. They pledge to encourage their members to avail themselves of the ongoing vaccination exercise.
I am encouraging people to come and be vaccinated because it is the right step taken by our government and our health personnel. And I'm sure government will not cheat its people because it's not a financial issue. So that I can say this is corruption can be. This is health issues. And we have already seen that our president have already taken it.
The sensitization idea is a good one because we really need to understand what can help our people to live healthy. Yes, especially with the pandemic that happened, it wasn't pleasant at all. It was a challenging period. And if there's anything we so desire is that our members be healthy and be able to do their normal functions.
With this sensitization, the word will hopefully spread to more residents of the state about the existence of the virus and that vaccines are the best forms of protection against it at this time.
According to the World Health Organization, variants of concern, VOCs, or variants of interest, VOIs, are detected and assessed based on the risk posed to global public health. As these risks evolve, WHO updates the list of global VOIs and VOCs to support setting priorities for surveillance and research, and then that ultimately guides the response strategies. Now, national authorities may choose to designate other variants of local interest or concern, and they are encouraged to investigate and report the impact of these variants. Well, let's take a look at the WHO's classification of variants of concerns and also the variants of interest. And from the side you're about to see now, you would see the WHO label that gives the alpha, which was documented in the UK, September 2020, and given the designation date, 18th of December 2020. And there's also the beta, which was also designated on the same day, but then that was documented in South Africa, if you remember, the B1351. There's also the gamma, which is the P1, Brazil, November 2020. There's, of course, the delta, which is indeed the virulent transmission that is taking place around the globe at the moment. And then you have the variants of interest. There's the epsilon, documented in the US in March 2020. There's the zeta, the eta, the theta, the Philippines. There's also the kappa, and that's also another variant of interest, first identified in India, and you have the lambda of Peru. So these are some of the classifications the World Health Organization has done to the variants of concern of COVID-19 around the globe at the moment. And this is the latest as of the 29th of June 2021. Well, let's talk some more about all of the variants, especially the virulent Delta variant. And joining us via Zoom is Professor Titus Ibekwe, consultant ENT surgeon. Thank you for joining us on the program.
Thank you very much for having me.
All right, Professor, is this virus evolution expected as more SARS-CoV-2 circulates?
Yeah, you've done an excellent classification there. The World Health Organization decided to use the Greek letters in classifying the various variants, of the COVID-19. This is to avoid stigmatization of the countries where these variants were first discovered. And we know that these variants have some little or even some extensive, variations in modes of presentation in its structures, etc., and response to the various vaccines. Talking about the Delta, which is the one that is raging right now, we know that it has caused a lot of problems in India. The morbidity mortality rate in India has been extremely high. And recently, this has, been seen to have affected various countries. United States has this, and it's known that today in the UK is overtaking the Alpha, which is the original one that was found in the UK. And going by this, the Delta variant, the structure is different from the original variants that was found in China, because it has double strikes of protein. The spikes of protein, they are double rather than single as it is seen in the original one. And this has bestowed to this particular variant some level of infectivity more than the original one. It tends to be more contagious, than the conventional COVID-19 infection. The clinical presentation also varies because it mainly presents with headache instead of the other conventional cough, fever, etc. The main presentation here in the Delta variant is headache, very severe headache. And all those red flags that we used to see in the conventional one, which has to do with loss of smell and taste, you hardly find this in the Delta variant. And the rate of the risk of hospitalization for those who have the Delta variant is about ×2 what you see in the original one. And response to the various vaccines has also been documented following some recent findings. Those who have complete vaccines, both first and second doses, have been found to be protected to some reasonable extent. About 88% of such people have been protected. That's for those who have the UK variant of the vaccine, and those that also had Moderna, that's AstraZeneca and Moderna, tend to be 88% protected. But those who have Johnson & Johnson, which is just a single dose, about 60% of them tend to be protected from, this Delta variant. And for those who have just a single shot of the AstraZeneca, vaccine, only about 30% protection is offered to them. And mainly children are not protected with Delta variants. We've seen lots of cases of infections of COVID infection in children,
So,
compared
Professor,
to the original variant, which tend to be protective, and is creeping into Nigeria and some other African countries. So we have to be on guard.
Very crucial is the strategies. What must we do to cut off, to reduce the mutations?
Yes, well, the earlier the infection and the transmission chain is broken, the better for each and every one of us. The preventive measures are very, very important. And this is why it's stated that, yes, you take your vaccines, which is very key, very important. Or even after taking your vaccines, because there's no 100% protection, you should still go ahead with, the non-pharmaceutical, modes of protection from the infection by using your face mask, washing regularly as much as possible, avoiding crowding. So we should not throw away those, simple mechanisms that we have been used to all along, because simply we have gotten vaccinated. That's one leg, very important. If you are not yet vaccinated, you should make sure that you get vaccinated, and not just one dose, ensure that you have a complete vaccination. Then you're closer to it, and you go ahead and still apply the precautionary measures. Once this is done, over time, the infection chain will be broken, because we are talking of viral infections here. That's why it's a very difficult, illness to actually handle, because viral infection is propagated over a long time, but over time, it will circle out once each and every one of us perform the responsibilities expected of us towards prevention.
As expected, the new normal. We appreciate your time. Thank you so much, Professor Titus Ibekwe, consultant ENT surgeon. Thank you for joining us on the program.
Thank you, Millicent, for having me.
We have an update of vaccinations across states in Nigeria, and we also have the global update. Stay with us. Welcome back. And now to some of the vaccination updates across states. We begin in the South, where in Cross River State, the state government says that over 15,000 people have received the second dose of the AstraZeneca vaccine since the second phase of vaccinations began. According to state authorities, sensitization as well as other measures are in top gear to ensure those who have not taken their first jab get vaccinated as soon as the federal government makes available the vaccine by August or September. Over in Adamawa State, it's been a success story for the vaccination exercise. There, all seekers are getting vaccinated. Over 59 doses of the AZ vaccine, which was allocated to the state. As a result of the community mobilization embarked by the state government, there is an increase of people requesting the first dose of the vaccine. The state says the opportunity will come for all indeed to get the complete doses. Over in Imo State, the state government says about 50% of persons who took the first jab of the COVID-19 Oxford AstraZeneca vaccine have received the second jab. The executive secretary of the Imo State Primary Healthcare Development Agency said that in Imo State that the government is doing everything possible to ensure that indigents receive the second jab. The executive secretary says the state government will continue to ensure that it also delivers quality healthcare for the people in the state. While some African countries are faced with a third wave of the pandemic, Uganda's drug authority has approved the herbal medicine COVID-19 for supportive treatment and management of viral infections. Dr. David Nahamya, the executive director of Uganda's drug authority, said the approval followed a 2-week scientific evaluation of the medicine's safety and its efficacy. Uganda recently received 175,000 doses of the AstraZeneca vaccine, but is inoculating only frontline workers, with just 856,025 people vaccinated in the country. Many members of the public have resorted to using COVID-19 to treat COVID-19 symptoms. Well, joining us right now is Mr. Emmanuel Anyebonya, Uganda Ministry of Health spokesperson. He joins us now via Zoom. Thank you for joining us on the program.
Thank you for having me. Good evening.
All right. Tell us, how effective is COVID-19 to the treatment of the coronavirus disease, or should I say attempted treatment of it?
Thank you very much. If you read the statement issued by the National Drug Authority here in Uganda, it indicated that it had notified the drug as a harmful supportive treatment for viral infection, and it clearly stated that it does not cure COVID. So the innovator or the scientist behind this drug is supposed now to have it subjected to clinical trials, but as the population uses it as a supportive treatment for viral infection, like also it can help to relieve someone of symptoms which are associated to COVID-19, but it clearly stated that it is not a cure for COVID-19.
Well, we've also heard the WHO say that it's not approved the substance for COVID-19 treatment. How does the Ugandan government feel about that? And this is because aren't there side effects to taking this treatment?
Yeah, for now, the drug has been subjected to preliminary checks that led to its notification. It will undergo clinical trials, and once it is passed, maybe that is when it will be submitted to World Health Organization. But for now, it is a supportive treatment for viral infections as the population goes through this second wave of the pandemic.
We hear that Ugandan pharmacists are saying they have little choice because drugs authorized for emergency use in developed countries are not available. But when is Uganda expecting the next batch of vaccines?
The drugs, it's not true that the drugs approved for emergency use are not available. They are available here in Uganda. But the population has preference on what kind of drugs they want to be subjected to. And also, we expect the next batch of the vaccines mid-July and also sometime in August. So we hope that we shall have vaccines required for the people who will be taking second dose and also those ones who will be taking first dose. The focus is not only health workers, because our initial vaccination rollout plan had targeted a number of people who included health workers, security personnel, teachers, and also people who have underlying conditions like hypertension and diabetes. And now the only limitation now is that the 175 doses are being given to those ones who are taking their second doses, and we have vaccinated or close to 1 million people, about 900,000 members of the population. So we hope to reach out to the other groups as and when we have vaccines in the country.
All right, and perhaps we'll speak to you then. We always appreciate your time. Thank you so much for joining us on the program. Mr. Emmanuel Anyebonia, Uganda Ministry of Health spokesperson. Thank you.
Thank you for having me.
Now, the World Health Organization, WHO, is warning of a new COVID-19 wave in Europe as a 10-week decline in new cases ends. It urges local authorities in host cities to better monitor the movement of Euro 2020 football fans. Here's our global update.
Thank you, Dr. Smallwood.
The World Health Organization says crowds at Euro 2020 football stadiums and in pubs and bars in host cities are to blame for the current rise in coronavirus infections in Europe.
A 10-week decline in number of COVID-19 cases in the 53 countries in the WHO European region has come to an end. Last week, the number of cases rose by 10%, driven by increased mixing, travel, gatherings, and easing of social restrictions. This is taking place in the context of a rapidly evolving situation. A new variant of concern, the Delta variant, and in a region where, despite tremendous efforts by member states, millions remain unvaccinated.
The WHO is not alone in their thoughts of the Euro 2020 crowds, as German Minister Horst Seehofer has also voiced his opinion, saying the European soccer governing body, UEFA, is utterly irresponsible for allowing big crowds at the tournament during a spike in the coronavirus crisis from the Delta variant. With COVID-19 restrictions varying from nation to nation, crowd sizes have ranged from completely full, such as 60,000 in Budapest, to 25 to 45% capacity in other venues where there have often been around 10 to 15,000 spectators. Away from Europe and over to Thailand's resort island, Phuket, as it reopens to vaccinated tourists under a pilot program to revive its devastated tourism industry.
Paperwork's a little bit difficult because it's new, doing it through the embassy, but yeah, it worked pretty quick, very fast.
Millions of people visited Phuket every year before the pandemic, and Thailand lost about $50 billion in tourism revenue last year alone. In Bangladesh, police officers checked vehicles and army soldiers patrolled streets in the capital Dhaka as country entered a strict lockdown, allowing only essential good carriers and ambulances to move on the streets. The country recorded 115 coronavirus deaths on Wednesday, bringing the total to 14,503 overall. And lastly, New South Wales, Australia's most populous state, reported 24 locally acquired COVID-19 cases as the state capital, Sydney, nears a week of a strict lockdown put in place to contain an outbreak of the highly contagious Delta variant of the coronavirus. Around 1 in 2 Australians are currently under stay-at-home orders, while millions of others have been subjected to movement curbs and mandatory mask wearing.
The public health and safety measures continue across the globe. Let's continue to take responsibility. You can visit our website for more updates, also a better understanding of the pandemic. The latest there for you. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.